Thanks, Lauren. I'm Shannon Fitzgibbon here with your weather forecast here in sunny or not so sunny Allendale. First off, we're looking at our clinical climate. Recreational therapy is a clinical profession that embraces an evidence-based practice. So we use research and proven methods to create treatment plans for our patients. It's not just play, it's play with a purpose. We utilize these different play techniques in order to accomplish goals for our patients. We also utilize different established medical models like the mental health recovery model and follow guidelines from trustworthy associations like the Schizophrenia Patient Outcome Research Team. These different models and different associations align with our different guidelines, practicing guidelines, our different tools that we utilize and different methods that we utilize in order to accomplish our goals for our patients. Just because we practice in different settings doesn't mean that our process is different or anything less than any other therapy. We use an API process, which stands for assessment, planning, implementation, evaluation, and sometimes documentation. This diversity is one of our strengths. It's not a weakness. We can practice in pretty much any setting that you put us in with any disability. So it makes us very versatile, and we like to see that as a strength rather than a weakness. One of the images on the screen here, you can see we're practicing bowling, which can work on different gross motor skills, strengths, aiming. A lot of different skills can be used, and a lot of different skills can be valuable to these patients, even though we're not in a hospital setting. Next, we have our predictions. All of our kind of growth as a profession starts with education and understanding. We are a growing profession, so this is key to growing. We can't grow without people knowing who we are and what we do. So this can include leisure education, so the importance of leisure as a therapy method, and how we use that method in order to help our patients. Like I said before, it's more than just play. It's accomplishing these patient-directed goals in a way that they can actually enjoy and use when we're not there. This can be done by community outreach programs. We can partner with public health organizations in order to reach more people and talk about the awareness behind the benefits that can come from recreational therapy. Firsthand accounts and anecdotal evidence can be key to this. Word of mouth is a really great way to spread our message and our importance in the clinical field. We can also experience growth, which we have been experiencing and hope to continue to experience through ATRA conventions, professional associations, continuing research, and continuing education, which we need to maintain our certification. So that's all super important in growing our profession and growing our span of practice in order to help more people. In conclusion, for our broadcast tonight, recreation is not only beneficial, but it's necessary. It's a way of seeing the person as a person instead of a problem, a disability, a diagnosis. And that's really what makes us different. These on the right-hand side here are the 6 dimensions of wellness. This really encompasses everything that we mean by holistic rehabilitation. So we have environmental, emotional, intellectual, physical, social, and spiritual. And these are key to forming a holistic plan of therapy, rehabilitation, recovery for all of our different patients and clients. So all of these different dimensions of wellness have to be taken into account when we formulate these plans in order to create active leisure participation that actually has these wanted impacts on our patients. So one example of this can be a walking club for seniors. So this kind of takes into account the social benefits of walking with other people. You have physical benefits, obviously, getting up and being active. You can have those emotional supports. If you're outside, you can improve your environmental wellness. There's a lot of different things that can come from leisure activities that sometimes we don't recognize right away, and that's kind of the beauty of it, is some of these benefits can be hidden and people don't really discover them until they participate. So that's awesome. Another thing that's important about recreational therapy is the patient-directed recovery. So patients get to take control of their rehabilitation and not just have a doctor or physical therapist or an occupational therapist tell them what to do. They get to be an active part of their recovery. They get to decide what their goals are, what they want to do. This is extremely important when we talk about leisure, because self-directed activity decisions and individual goal setting is part of leisure. Everybody participates in leisure. So people know that it's about what you enjoy. If you don't enjoy it, it's not going to work. So we have to communicate really well with our patients and our clients to be able to kind of implement their favorite activities, their favorite hobbies, things that they like into their treatment plan. And leisure education plays a huge role in this, because if they don't know what's out there, they can't really direct their own care. So we got to kind of inform them about what's out there first, and then they can decide where they want to go with that. Everyone participates in leisure activities, like I said. So there's a diverse population of people that can be helped through recreational therapy. We can help veterans with PTSD. We can help the elderly. We can help children with developmental disabilities. Everybody can be helped by having a more saturated leisure lifestyle. So that being said, recreational therapy is necessary. That's what's breaking tonight. Thank you for tuning in, and we will see you next semester on RTX 300.